Hello and welcome. Happy Friday. We're live on the internet for another episode of the Cole Memo. In today's episode, we'll focus on upcoming changes that will impact medical cannabis patients in the state of Illinois. I'll also share some takeaways from some presentations that I attended that featured state cannabis agencies. So they shared some information that I will be sharing with you in the spirit of full transparency. I'll also break down Governor Pritzker's latest comments on federally legal cannabis, what some people are calling hemp. I will be bringing on some people from that industry so that we can get their takes. I'm curious what they think about Governor Pritzker's latest statements on the matter. All of that and more right here in this episode of
The Cole Memo.
The Cole Memo.
The Cole Memorandum.
The Cole Memo.
The Cole Memorandum.
The Cole Memo.
The Cole Memo is what allows this whole thing to go on.
I mean, you have to respect the memo.
Hey, this is Tommy Chung, and you're listening and watching The Cole Memo.
Once again, we are live on YouTube, Instagram, and Twitter, so feel free to drop your questions or thoughts in the comments, and as we go along, we can feature them and address them on screen. If you're catching this later and you're wondering, Cole, how do I catch the show live? I'd say the best way is to go to colememo.com/YouTube. From there, you can click the button and subscribe to my YouTube channel. You should also click that little notification bell within YouTube so that you never miss a stream. The podcast also streams on platforms like SoundCloud, Spotify, Apple Podcast, and all other major podcasting platforms. You can also just go to colememo.com/podcast to stream the audio version of the podcast, though I will say the video version, we display things on screen and stuff. So you might prefer the video version, which is available on platforms like Spotify, YouTube, and more. To support the show financially, head on over to colememo.com/support or become a patron at colememo.com/Patreon. For just $3 a month, you can help keep the show going and get early access to my content. Once again, that's at colememo.com/Patreon. That's colememo.com/Patreon. You can also sign up for email updates at colememo.com/subscribe. I share news on my website, updates, and upcoming show information every so often. Nothing spammy. So if you want to subscribe and stay in the loop, once again, that's colememo.com/subscribe. And I will just say that one of the best ways to show your support for this show, especially if you're watching or listening on platforms like YouTube, is by hitting that like button, subscribing, or giving the show a favorable rating from wherever you're tuning in. It really does help more than you might think. I know that all content creators are like, smash that like button, yo. There's a reason for that. And it's because when you do things like that, when you engage with my content, from what I understand, it may suggest my content to more people. So if you're looking to support me, I'd say one of the best ways to support the show that's absolutely free is just to engage in the show. Like it, share it with your friends, subscribe. If you can, go to Apple Podcast or Spotify right now and give the show a favorable rating. Give us a 5-star rating or something like that. That would be super, super awesome. All right, folks, let's get this show moving. Are you ready for another episode of the Cole Memo? Let's go. Yeah, I'm trying to get something rolled up here in those little music breaks, and just about did it. Just got to put the paper in. Folks, how's it going? Apparently some people are having some glitches with YouTube. I'm displaying comments right now because we are live. If you comment below, I can display the comments as we go through the show. Somebody says they are rolling up with me. Anybody else rolling up with me this afternoon? Like I said, I just about got this joint rolled up. It's 2 minutes. It's 4:22, which means you can start smoking right now. Because if you missed 4:20, well, this is 4:22. Get it? You get the joke? I didn't make it up. You've probably heard that joke before, but oh yeah, we're getting hot and heavy on this episode of the Cole Memo. Genetic Memory Farms also commented and said, "So what the heck did Pritzker say?" We're going to get into that probably at the end of the show. We're going to be talking about Pritzker's latest statements on hemp. It's something that I did. I covered one of his latest statements on hemp in the last episode that we did. I wrote an article about it at colememo.com. But just this week, he made another statement. And so we're going to be getting into that and more. I hope you're all having a good Friday. Once again, looks like Mr. M is smoking dabs out of a bong right now. Good times. That does sound like good times. Hell yeah. And Genetic Memory Farms is saying if you post a comment of 8 words or more within the first 15 minutes of the episode ending, it drastically increases the urgency in the algorithm. That's cool to know. So, folks, if you want to support me, there's another way to support me. You can leave a comment of 8 or more words within the first 15 minutes of this episode ending, and apparently that'll put the show in front of more eyes. Cheers to that. What are you guys smoking on this afternoon? I am curious about that. Smoking on some homegrown, and I don't know what the strain is, but it's homegrown. So cheers. We're going to be talking about oh, Penny Hart says, I'm posting a comment. Wait, it wasn't 8 words, but this is. Thank you, Penny. I appreciate you tuning in, my friend. And today we're going to start off the show with some updates that might be relevant to Illinois medical cannabis patients. Somehow I neglected to discuss this on the show. I have discussed this in the past, but I haven't discussed the latest with it. So if you'll recall in the past, I have discussed the idea that the equivalencies are changing for medical patients. You might recall this specific graphic that I shared. And at the time, I was just sharing it. And I was like, if you'll recall, I was remembering a time and I wasn't sure if I was remembering accurately or not, but I recall a time that the equivalencies were 1-to-1 for medical cannabis patients. Now, I will say that what I mean by that is like 1 gram of concentrate equals 1 gram off of your allotment. I also recall a time, and that was before the time that I was just describing. It was when I first got my medical card that I went into a dispensary and they were like, Cole, you already went through your allotment. And I was like, there's no fucking way I went through 2.5 ounces in a week. And they were like, oh no, it's because the cartridges. They were like looking, they're like, oh, Cole, it looks like you buy a lot of cartridges. At the time I did. I was addicted to cartridges. And at the time, cartridges took like 6 to 7 grams off of your allotment a pop. So like if you bought a 1 gram cartridge, you would think, oh, that would just take 1 gram off of my allotment. No, it would take like 7 grams off of your allotment. I used to know a formula for how that was calculated. And then I don't know, I forgot it, but now we know it again because they've published the equivalencies. So I'm putting it back on screen right now. These were the equivalencies that they announced. And what I want to point out is that they said here, medical purchase limits have not changed with the new seed to sale system. And I was like, I don't think that's accurate. But whatever. I'm not going to get into that. But what I will say is that they recently announced new equivalencies, right? So they said, hey, now 1 gram of concentrate equals 2.66 grams of flour, which is down from the 3.33 they had pointed out that they had said. Now, this is what stands out to me. The reasoning says the reasoning that they give makes me feel less insane for all the things that I was just talking about. They said the concentrate flour equivalency is being updated within metric for limits to be closer prior to switching to metric. Wait a minute. I thought you said nothing changed. You said right here, nothing changed. Medical patients have not changed with the new seed to sale system. So these allotments that you announced, those aren't new. But then over here, you say Am I just reading this wrong? That's my question to the audience right now. They say it right here, if you can see my mouse. The concentrate flower equivalency is being updated within metric for limits to be closer prior to switching to metric. Well, then what if I'm just confused? Because again, I thought that they didn't change. Am I like getting too am I too high? What's going on here? Do you guys agree with what I'm pointing out here? Because look, my anecdotes are they're anecdotes, right? I will say that other people have shared similar anecdotes where they're like, Cole, I remember a time where cannabis purchases were 1-to-1 on your allotment. Again, 1 gram equals 1 gram. But apparently that is, I don't know. I'm just asking questions here. And Pennyhart says it's almost like the state doesn't want you to buy weed from them. I swear, sometimes it feels that way. Sometimes it feels that way. Mr. M, my clone commercial facility is almost approved for use. You will have to come out soon and check it out. Fire marshal is coming. Oh, are you from Cannabis Pro Media? I think you invited me to your facility, and yeah, I'd love to come out. We need to talk some more because we were having those discussions, and something came up for me personally. I wasn't able to make it out, and yeah, happy to come out. That'd be cool. Looks like Genetic Memory Farms is smoking on C99 and Dep Chunk, a Vietnamese black crossed with Hawaiian Cherry Bomb, crossed with C99. I don't even know what the fuck. That sounds crazy, though. Oh, it looks like you're doing breeding projects. That sounds about right. I was going to say I've never heard of that. But again, before we move on, what do you think about that? I'm just announcing this because it relates to medical patients. I have some other news that relates to medical patients, but just curious. Do you remember what I remember? Does that stand out to you like it stood out to me? Like, again, I'm just curious what you guys think. Like, I'm getting caught up on, apparently they've not changed with the new seed to sale system, but then here they're like, well, we're switching it back to what it used to be before the seed to sale system came around. It's like, wait a minute. I thought you said it didn't change with the seed to sale system. Who knows? Who knows? Next up, I'm going to talk about this article that I published, which, just for background, I went to the Medical Cannabis Advisory Board, and that was on September 15th. And so I attended that meeting. And if you didn't know, the Medical Cannabis Advisory Board is a body that makes recommendations to the Illinois Department of Health. They make recommendations on additions to the list of qualifying conditions for the medical cannabis program. So at this meeting, representatives from several cannabis-related state agencies gave presentations about their roles, work, and what patients and consumers might expect in the future. So I took the time, a lot of time, to write this article out, and I'd love to sort of go through it with you all. So during the discussion, board members asked if the state would provide presentations for public review. I also asked this same question. They said, hey, Cole Preston wants to know, these presentations that you're technically showing to members of the public right now, would you be able to attach these presentations to the meeting minutes so that the public that couldn't make it to these meetings can see these presentations? And officials explained that they would follow up with the individual presenters to determine whether or not the documents could be shared directly, which I'm like, you're sharing them directly with us now. But officials seem to indicate that if permission is granted, the presentations will be attached to the meeting minutes or distributed in some fashion by the Illinois Department of Public Health. Otherwise, the public will be informed on how to request the presentations directly from the agencies. And that last thought, I think, is what they're going to tell us, if they even follow up at all. You can be sure that I will follow up. I already reached out to one agency asking for their presentation because I noticed they skipped over some slides that I really wanted to see. And so I would like to see these presentations. And I'm not saying like you're going to see a slideshow and it's going to be a smoking. I'm just interested in this stuff. And I think that this information should be available to the public, especially if it's like sort of being presented in the public. So in this article that I wrote, I share updates from each department and I highlight points that I thought were most notable for patients, consumers, and the general public. And I just want to give a heads up to everybody that's listening right now. I said that the Medical Cannabis Advisory Board accepts petitions to add new qualifying conditions. Just within the last year or so, Chicago Normal successfully pushed through some petitions for, I believe, female orgasmic disorder, and I think another condition that's sort of related to pain, or a condition that a woman would experience, I guess is my point. I can't remember if it's like something anyways, I'll Google it and try to figure this out just because I'm curious. But I sort of wanted to let everybody know, public service announcement. If you'd like to submit petitions to add new qualifying conditions to the Illinois Medical Cannabis Program, they must be submitted between January 1st and January 31st of 2026. These submissions cannot be accepted beforehand, and applicants were encouraged to prepare thoroughly and organize their materials in advance, as the state must review and sort through all of the supporting literature during this limited 1-month window, which I'm guessing that's written into statute, that's how that's supposed to work, because I'm just like, why limit yourself to 1 month and also limit this? You'd think, like, if anything, you would like have the submission deadline due the month before you're supposed to do all the review, but I don't know. I just wanted to make that public service announcement. You can see the folks that in this article, if you have any questions about this, you can see I've listed email addresses. I'll make this a little bit bigger and highlight them for you. If you've got any questions on the process, or if you want to submit petitions, you'll email these people from the state of Illinois. So, yeah, just keep that in mind if that's something you want to do. And I'll just say that what I found notable about the last time that they sort of had this debate, or I shouldn't say debate, the last time they went through this process and had petitions submitted, I thought that Chicago Normal had some really solid reasoning behind, obviously, the conditions that they proposed. I don't remember what the other one was, but it was like, of course, that needs to be on as a qualifying condition. But the real point that I thought they made, that I just thought was brilliant, there was a comment that was made by one of the board members. So the board members, again, review the petitions that have been submitted. And there was a comment made, something to the effect of like, we really need to vet these conditions, because it was almost like they said something to the effect of they want to be the gatekeeper for this process. And they just want to make sure that, and I don't have an exact quote because this had to have been 6 months ago. They said something to the effect of like, we don't want to like just let every condition on. And as I recall, and if I recall correctly, Chicago Normal had a really brilliant response to that, which is just like, you would think that the state would want as much data at their disposal as possible. So in other words, like, yeah, add whatever condition. Add, my knee hurts. That's what I'm using medical cannabis for. Penny Hearts says Chicago Normal never has solid reasoning. Hear me out here. I thought their reasoning on this specifically was interesting, because it's like, if you want to see who or what people are treating or using cannabis to treat, like, wouldn't it make sense to just let them list their condition? And I thought that was interesting. I was like, yeah, like, why are you pigeonholing people into picking migraines or PTSD or chronic pain, when like they could just be honest about what they're using cannabis to treat, and then you have that data at your disposal? I'm curious what you all think about that. I thought that was like a pretty solid argument for almost any condition. And yeah, Satisfied Mind says adults can go buy cannabis in the state legally. If they want to pay for a card, let them. And like I say, I think that's absolutely accurate. That's right on target. And I just thought that that reasoning, like I said, was pretty solid. Why not? Why deny more data? Sort of was the question that I recall being posed. So the Illinois Department of Financial and Professional Regulation, on the shorthand we'll call IDFPR, So Vaughn Bentley, who I have had featured on the podcast in the past, I sort of got a quick press. I was able to press him quickly at a Grown In event in the past. He explained that the IDFPR agency oversees licensing for dispensaries and their employees. They approve staff training programs and they enforce compliance to protect public health and safety. Illinois currently has 263 licensed adult use dispensaries, but only 55 of them are authorized to serve medical cannabis patients. Those 55 locations were originally issued in the medical cannabis pilot program that launched around 2014. And there's going to be an interesting comment we're going to read here in a little bit. And I want to give some context as to where this comment came from, because you're going to be like, whoa, that's a strongly worded comment. Where's this coming from? Vaughn said a few times through his presentation, and I didn't quote him on this, but he said something to the effect of we must remember the medical cannabis program is the bedrock, the foundation of our adult use program. And so, like I said, the original 55 medical licenses from 2014 have remained the same, though some have changed location or ownership. And that was according to Vaughn. The total number has not increased since the program began, and expanding to add more medical dispensaries would require a change in state law. And yeah, Cannabis Critique knows exactly what we're talking about, and we'll get to that. They do say the state says they are supportive of this idea, but it requires legislation. I just realized I missed a follow-up comment by Penny Hearts. They said Chicago Normal does good work here and there, but Chicago Normal is anti-free market, anti-hemp, and anti-consumer. That's what Penny Hearts says. And yeah, I'm curious what you all think. Do you agree on that? It's Genetic Memory Farms also says I've become very suspicious of Normal. I don't know if you're talking about Chicago Normal or just Normal. They say they seem to have lost the plot and don't seem like they're fighting for consumers anymore, but for the industry. Why are they not fighting for home grow for all? So anyways, Bentley addressed how Illinois awards new dispensary licenses. He explained that because the licenses are capped by statute, the state uses a lottery system, which he described as the most equitable way to distribute opportunities. I'm curious what my friend Penny Hearts thinks about that one, about that comment. Bentley described the lottery as the most equitable way to distribute opportunities. And as you'll find detailed in my article, and I've got hyperlinks, the lottery process has not been without controversy. Previous lotteries drew criticism and even legal challenges, with outlets like Grown In and others reporting on confusion, delays, and concerns about from applicants about fairness and transparency. I knew you'd have some thoughts on the lottery. Yeah, check out all those links that I have hyperlinked in this article, folks. I'll throw this link in the comments right now. It'll be in the episode description later if you're checking that out. Check out these stories, because there's a lot of good stuff here. And I think one of them I even linked to might be my mini documentary, but I can't remember. I know I definitely covered the lottery in the mini documentary. But for consumers, here's some updates for consumers. IDFPR highlighted several changes that are already in place. Curbside pickup for medical patients, which began as a temporary measure during COVID-19, is now a permanent option at dispensaries. You might remember that I worked with several other advocates in the space to pressure Governor Pritzker's administration and others below to sort of codify this change. And it happened, which has always made me wonder, what else can we just do like that? What else can we just we're going to do this? It'd be interesting to see how far that goes. Bentley mentioned that new adult use and medical dispensaries took effect in, quote, the last year or so, end quote, and said that they are aimed at improving transparency, safety, and the consumer experience. But Bentley did not specify which rules he was referencing in this part of his update, and that remains unclear to me, because improving transparency, safety, and the consumer experience does not seem like words that I usually see in the same context as the Illinois cannabis program. Vaughn also shared that updated training requirements for dispensary staff are rolling out this year. And additionally, the state has transitioned to metric a new seed to sale system. We've talked about that. I think that's probably what this hyperlink that I'm displaying leads to, my article on that. And he actually gave some information that I was not aware of. He said, despite initial challenges, it's expected to improve communication and transparency across the market, saying in a quote, the transition, as I'm sure everyone on this call knows, which I'm just going to butt in here and say I did not know, but I'll continue on his quote. He said, quote, the transition, as I'm sure everyone on this call knows, has not been fully smooth or free of issues, but it has resulted in increased transparency, better communication between the industry and consumers, and a number of steps forward for dispensaries. Again, not very clear what he means when he says those things, but they do sound nice. Looking forward, IDFPR is implementing a new licensing system called Core. I Googled it. I hyperlinked it here in this article if you're curious what it is. I think IDFPR has already launched it, but maybe they're just like going to be launching it within the context of cannabis. I don't know though. Dig in deeper if you're curious on that. This is really interesting. I found this super notable. For patients, one of the most significant upcoming changes is the launch of a metric patient portal. And I think I've reported on details of this in the past, and I've asked the state about this in the past. I'd have to look it up. I remember asking about a patient portal. I didn't know that it would have some of this stuff. They were saying that this tool will allow medical patients to check their purchase history, their remaining allotment, and other account details without needing to call or visit a dispensary. Bentley also emphasized that IDFPR is working with lawmakers to expand access for patients by allowing them to shop at any dispensary statewide while still receiving the medical tax rate and higher allotment benefits. So again, for folks that we're talking about medical at all dispensaries, the state says they're supportive of that idea. Yeah, Penny Hearts is talking. I missed these comments from Penny Hearts. He said, remember when they held a lottery for the MSOs, they had people in the room to watch. But when Social Equity got a lottery, it was a program, a computer program that no one had insight into. And that's why earlier Penny Hearts said it's a fake lottery. He's made that joke in the past. And I love it. I don't know. You got to wonder. Nobody saw what went down. Somebody said lottery is fair. Lottery is far from pulling a bucket, but how do you get in the bucket? Yeah. This med program has been allowed for 10 years and they just got a way to check allotment. Right. Yeah. Yeah. There have been other workarounds. I guess some people will like sign up for a dispensary in Chicagoland that somehow tapped into BioTrack/Metric. And people have told me they will sign up for this dispensary in Chicagoland. They don't even live in Chicagoland, but they have some utility on their website that allows them to check their allotment. So like you say, the state is just now delivering sort of like a state delivered solution on this. And it's kind of depressing if I could it's been over 10 years. In Satisfied Mind, you got the right dispensary, but I'm not going to give them free advertising. So if you want to see that, check out that comment if you're wondering which dispensary I'm talking about. In response to public questions, Bentley noted that the agency, IDFPR, cannot mandate more CBD-rich products or set prices in inventory, though competition may naturally stabilize these issues over time. Yeah, if we had some competition in the state, I'm sure that would happen. But of course, the way that the state market is set up is to protect these operators against natural market forces. And so I'm not sure that we're going to see any changes in prices and definitely not inventory. There were a lot of questions about inventory during this Medical Cannabis Advisory Board meeting. People were saying like, hey, there's these medical strains that existed between 2014 and 2020. And ever since adult use came around, we have not been able to find these medical products. And we've got, these healthcare providers were saying we have patients that benefited from these products. Is there any way that the state can mandate growers to continue to cultivate those products? And the state said, no, we can't mandate what they grow. We cannot set prices. We can't help with that. With regard to the question of the CBD rich products, it is worth noting that the Illinois Department of Agriculture has allowed 2 growers in the state to grow CBD cannabis, or low THC strains of cannabis, otherwise known as hemp. And that was recently covered in the Chicago Tribune. They mentioned my work on the subject because I helped to break the story with, of course, the help of you all. Several industry workers sort of tipped me off that this was happening. Honestly, when I started researching that subject, I just thought it was interesting that they were growing outdoors. I had no idea that they were technically growing hemp. And with everything that we're going to be discussing later, it's sort of hilarious. But we'll get to hemp later. I did write this quote. I don't remember writing this quote. Vaughn Bentley said, "We did receive 2 additional questions on how to make inventory." Oh, that's just reading the information that I said above. I will read this quote though. He says, "So we are pushing forward, as I said, with legislation and attempting to pass legislation that would allow medical patients to shop at any dispensary. But outside of those efforts, there's not much we can do. This is outside of the agency's hands." And, yeah. So, Vaughn acknowledged it can be difficult for people to tell which dispensaries are medical versus adult use only, but pointed to the state's website, which publishes updated lists of dispensary locations. There was a question about banking, and the agency said they're coordinating with the state's Division of Banking and following federal efforts on the Safe Banking Act, which, of course, nothing is happening with the Safe Banking Act. So they're doing what they can, which is nothing. They can't do anything. So, yeah. So the takeaways for patients there are that while the patients are still limited to the original 55 medical dispensaries for their tax break and allotment benefits, IDFPR and other agencies in the state, as I understand, are actively pursuing legislation to expand that access to all dispensaries. And in the near future, patients will gain more control over their own records through a new online portal. Here's Vaughn reading since a lot of people are interested in this part of the story. Why can medical patients not go to any cannabis dispensary and use their medical cards for the tax break? Well, that would require a statutory change. It's something we're working towards. Every year is in our proposals, and we have brought language to both the Senate and the House previously, and we are continuing to work to push that forward. So again, there was some heated comments, made after this, and we're going to go through them now. So after Bentley's presentation, longtime medical cannabis advocate Jim Champion offered a very pointed comment. Champion, in case you didn't know, is a veteran, and he's the first registered patient in the Illinois Medical Cannabis Program. If you look up the Illinois Medical Cannabis Program bill signing, he was present with Governor Patrick Quinn. He's been there since the very beginning. He was one of the earliest public advocates for patient access and pushed for reform even before the state's first medical cannabis law. I should say the second medical cannabis law, because the first medical cannabis law was technically the Cannabis Control Act of 1978. That's a rabbit hole for you to go down. Or you can go to colememo.com/history, where I think we've got episodes on that. But the second, I'll be a nerd here, the second medical cannabis law, Jim Champion helped to pass. So he said, quote, "I would like to say that I started working on this bill to pass it back in 2008. I worked on it and have been working on it ever since then. And the fact that we only have 55 dispensaries for medical and 208 for adult use is not only neglectful, it's embarrassing that we have just been, and you keep saying that we're the bedrock, and we should be the bedrock, because historically there are no adult use cannabis programs in the United States without first being a medical cannabis program. And as a patient, I will say that it feels like they rode our back to get here. And now we are stuck back. We're dealing with the 2014 dispensaries. I've personally been working on getting the dispensaries, getting the regulations changed in Springfield, and we've been working on opening up the dispensaries to medical patients longer than we worked on the original medical cannabis bill itself." That line really stood out to me. He continued, It's embarrassing. And I think that the state of Illinois, this medical cannabis program, the governor, everybody should be embarrassed. As patients, that's why we feel neglected, because there's too much, we can't do this and we can't do that. And we're still living by 2014 rules. He said, I've been working so hard to open up these new regulations, but every year it gets passed off. And now the bill has been passed off again by the speaker. He said, so that's more of a comment than a question, but do with it what you may. I'm curious what you all think about Jim Champion's comments. They were definitely heated. He definitely had something to say, and I tried to read it in a similar tone of voice as he did, to show you sort of the emotion that I remember him displaying on that subject. So curious what you all think. Like our friend Penny Hart said earlier, and as Jim Champion said in another way, this program is 10 years old. 10 years old. And we've not seen any changes really to the medical cannabis program. Let's be honest, Genetic Memory Farms says the industry has completely abandoned patients. It's up to private growers to give medicine to sick people because the state and the MSOs are not giving them anything, just taking money. That's Genetic Memory Farms perspective on the matter. Okay, so moving on to the Illinois Department of Agriculture, and then we'll have a few other stories to discuss. And our main story today will be Governor Pritzker's latest statements on hemp. David Lakeman, who has been on the podcast in the past and heads the Division of Cannabis Regulation at the Department of Agriculture, explained that his agency oversees everything outside of dispensaries, including cultivation centers, craft growers, infusers, independent transporters, and testing laboratories. I'm going to skip over some of this information because it's just sort of public information about what the agency does. If you'd like to read more, check out the full article. Lakeman highlighted the launch of the state's new Bureau of Cannabis Testing, one of the first state-run cannabis reference labs in the nation, built inside a repurposed former animal disease lab. The facility is expected to be fully accredited and operational in the first quarter of next year. The lab will allow IDOA to conduct its own testing with full chain of custody, respond directly to complaints, and oversee the accuracy and methods of private testing labs in the state of Illinois. This is something I've wrote about in the past. Each time I've seen them make a statement about it, sounds a little bit different as to what exactly it does. Because I specifically asked in the past, would this be used as a sort of audit on the existing labs? And based on what David said, he alluded to the fact that it would. But again, I've asked David himself in the past, and he said, no, this would not be an audit on the labs. And so if you want to see the different things they've said over the years to me on this subject, I would say check out this article, follow this hyperlink. I'll make the screen bigger. Follow this hyperlink right here. You can read what I've written on the subject, and it probably even links to episodes I've done on the subject if you don't want to read about it. But yeah, there's a whole statement in here. And in the past, I've told you all that I've actually seen this lab with my own two eyes. And I described it as looking like a high school chemistry lab. And for the first time, I'm showing you images of this. And as you can see, so this is how David showed the presentation. He didn't put it in presenter mode. And so if it looks like I took a screenshot off of somebody's computer, it's because I did. I did. And anyways, here are the images, and I'm going to zoom in here. If you look at this looks, I don't know what high school you went to, but this sort of looks, there's a lot more machinery on the desks, granted, but this looks just like a high school, like chemistry lab. And so, like I said, I've been there. It's actually, if it's the same location, it's in the basement of the Illinois Department of Agriculture. When I was shown it, I thought I might be about to get murdered. They're like, Cole, do you want to come down to the basement? I was like, I thought we were done here. What do you want to take me down to the basement for? Hey, it's a lab. So what this actually looks like in practice, I still don't know. I've asked Can we submit our own samples for testing? You would think that it's a taxpayer funded lab, that taxpayers could use the lab. And I'm not saying for free. Maybe we have to pay an additional fee. I don't know. But the answer seemed to be no, that the focus of the lab was to sort of work in concert with the industry. So turning to hemp, which I guess we'll be talking about later on in the show, but this was interesting. Lakeman described Illinois regulatory framework under the 2018 Farm Bill and USDA rules, which the state finalized last year. If you click this hyperlink, you can read when I wrote about that. According to David's presentation, Illinois has 77 licensed hemp growers, 169 processors, cultivating roughly 3,635 acres. He also gave historical context, noting that Illinois grew more than 40,000 acres of hemp during World War II under the Federal Hemp for Victory program, and emphasized that the state's climate and soil make it a particularly good place to grow hemp. And if you click here, this is a picture of hemp growing naturally in the state of Illinois, and sort of in a hilarious tone of irony, or I don't even know what the hell I'm trying to say. It's just amazing coincidence here. This plant is growing on the property of John Block, who was the somebody involved big in agriculture at a federal level. And today, the Illinois Division of Cannabis Regulation at IDOA is headquartered in the John Block building. Seems fitting, right? Cannabis used to grow on John Block's property. Now it's regulated in John Block's building. Not his building, but it's named after him, right? Okay, so Lakeman said the department is actively working with the governor's office, lawmakers, and partner agencies to update hemp rules with an emphasis on ensuring consumer safety around, quote, intoxicating hemp products. He said, quote, the primary thing that science has now delivered is the potential for intoxicating cannabinoids within hemp. The department has been engaged with the governor's office, with the administration, with our partner agencies on this meeting. Yeah, the other partner agencies on the meeting, as well as the legislature on finding potential pathways forward on ensuring that those products are safe for the consumer as well, end quote. In the past, David Lakeman has testified in support of legislation that critics argued would effectively ban all hemp-derived legal THC products from being sold anywhere except the state's limited number of licensed dispensaries. The measure, which had support from the governor, would have also sharply increased the penalties for cultivating, processing, or selling cannabis flower, concentrates, and infused products within Illinois. The legislation proposed $10,000 daily fines in addition to the existing criminal penalties outlined in the Cannabis Control Act of 1978 for unlicensed practice with cannabis. And I've got something one other takeaway for patients one other thing that will affect patients. But really quick, I just wanted to sort of drill down on what this could mean. If you were cultivating cannabis without a license, AKA without a medical card or just, a license issued from the state, and let's say you made a grow journal, from what I understand from the people that I've spoken to, if the state got a hold of your grow journal and you didn't have a medical card, they could hypothetically not only charge you for growing and the possession limit that you inevitably would exceed if you were growing without a medical card, they could also charge you with $10,000 daily fines in addition to the criminal penalties that you might be hit with. That's what I think is the real problem with this legislation. Besides the fact that I believe cannabis should be able to be sold in traditional retail formats, farmers markets, etc., I think it's wrong that we're increasing the criminal penalties in Illinois, a state that claims to have legalized cannabis in the spirit of social equity, which is supposed to be about making sure those hardest hit by the war on drugs are, I guess, given an opportunity to succeed. So it's like we're continuing the war on drugs while we're claiming to address the war on drugs. And I just can't wrap my head around that. But you guys have heard that one from me enough. That's probably that's like my line. That's my thing. That's what my whole mini documentary is about. Anyways, though, during the Q&A, Lakeman noted, and this is takeaways for patients and consumers. During the Q&A, Lakeman noted that any consumer can currently request a certificate of analysis at the time of purchase, and dispensaries are required to provide it. Vaughn Bentley, who again was from IDFPR, followed up by explaining that IDFPR is actually developing functionality within the metric system to make COAs easier to access through a QR code printed on the product packaging, allowing consumers to scan and view the certificate without having to access it. What do you think about that one, folks? I feel like somebody like Cannabis Critique, if you're still tuned in, I'm sure that one is big for you, because now for like your reviews and stuff, you can see the whole COA. And I don't know if that means you'll see like the terp levels and all that stuff, but I would think it would. It depends, I guess, on the tests that the cultivator pays for. And I think the terp tests are a little bit more expensive and they're not required by state law. So maybe, I don't know. It'll be interesting, but I'm curious what you all think. That's a pretty big take. I thought it was a notable takeaway for consumers. I remember the Cannabis Regulation Oversight Office had made an announcement about this in the past. I actually tried to find it so that I could link to it in my in this article, but I've not been able to find it yet. But I recall that the Cannabis Regulation Oversight Office had indicated that QR codes would be on products soon. I don't know that I have anything else to share in this article. There's other information, you know. There is one thing actually. So during the Q&A, a board member suggested that CROO, the Cannabis Regulation Oversight Office, could survey patients to better understand their barriers to care and experiences with the medical program, noting that the office has full access to the patient list. Steinfeld, which is a representative from the Cannabis Regulation Oversight Office, otherwise known as CROO or sometimes called CREW, responded that efforts like this would need to involve IDPH, since the patient registry actually falls under their authority. He explained that CROO's role is to coordinate state policy rather than directly manage the registry, but added that his office is familiar with surveys, pointing to a recent diversity survey they conducted with the cannabis industry that gathered feedback from licensees and employees, including their interactions with the medical cannabis program. And if you see a hyperlink here, it's because I wrote about that, and you can read more about that if you'd like. And I also will just mention I hosted a podcast with a medical professional who has since joined the Medical Cannabis Advisory Board. And in that episode, we went through a list that we made. Yes, we made a list. We went through a list of all the problems we thought the medical cannabis program in Illinois had, and how we would address those problems. And if you want to check out that episode, it's linked here in this article. So the only other relevant update I think I will share for patients and consumers, which is sort of the goal of this, is that apparently there's going to be a portal. So Steinfeld, the representative from CROO, added to Bentley's comments about the COAs. He explained that Metric has a consumer portal that Illinois is currently testing to ensure it works properly and complies with state law. The portal would allow consumers to view all products available in Illinois dispensaries with COAs attached for direct access. Steinfeld pointed to Massachusetts as an example of a state already using a similar system and said the feature could launch, quote, in the next month or so, end quote, though he cautioned, quote, don't quote me on that, end quote. Sorry, Nate. But, you know, I wanted to make sure I mentioned that you said don't quote me on that, because that means we might not see that in the next month or so. So Massachusetts, I tried to look up a consumer portal, couldn't find one. I'd be curious, people that are listening right now, have you ever seen this? Do quick Googles yield you any results? Because I wasn't getting anything. So anyways, that was a lot of good stuff. If you go to my article, you can see the agenda. You can also see that the next meeting takes place on February 9th, 2026, 3:30 to 5, or there could be another one scheduled with the call of the chair, but that's likely when the next one will be. I really want to put this call to action out here. You can sign up to speak at these meetings. You get 3 minutes. You just need to register ahead of time. And I put the email address in that you would need to contact if you wanted to register. Like I said, I made comment last time. It was mostly just to be like, hey, can you share this information so that I can share it with the public? But if you have something you'd like to say about the medical cannabis program and how it affects you, you can definitely sign up to speak, and you'll get 3 minutes and you'll get called in the order in which they register. So if you register today, you might be first up on February 9th, 2026. Who knows? Who knows? What do you think about all these changes? Like I said, it took me a while to write that article. Had to go over a lot of different notes. It was a whole thing. So I hope you appreciate the work. I'm just trying to share these updates because honestly, I've seen them shared by some folks like Illinois News Joint. I bet you're going to see some coverage by Support Dope People, the Elevated News podcast, because I saw Aaron was in there. I'm sure you're going to see coverage there. But other than that, I've not seen any coverage of these details. And so I hope you appreciate the transparency and that, that these things are coming down the line. So what are the people saying? So I'm reading the comments here. Genetic Memory Farms says, for any amount, for any activity, no more incarceration. We need that if we want it to actually be legal. Absolutely. And that's what I try to cover in my mini documentary. I try to make the case that we need to repeal the Cannabis Control Act of 1978, because again, it's like this law was created in 1978. It established this graduated set of penalties, and that law is still active. In fact, it's the primary enforcement mechanism for the cannabis industry. And this hemp proposal, which we'll be talking about here in a little bit, would add to that. It would just make it worse. And so that's why I tend to be critical of it, if you were to ask my opinion on it. But I know there are several cannabis consumers that are critical of it because it's just sort of antithetical to what this whole movement is about, which is access to the cannabis plant. So again, curious what you all think. I'm not seeing any comments roll in, so we can keep the show rolling. I appreciate you all. It looks like we got about 50 viewers between the platforms that we're viewing on. It looks like we've got some viewers on Instagram as well, which are not included in that count. So anyways, looks like we don't have any comments. So I think we will keep things rolling. You want to talk about hemp? Should we talk about hemp? Hold on a second. Do we have any other things to talk about? After this piece on hemp, I'm going to have people joining me from 2 different Illinois hemp associations in this segment. After this piece on hemp, if you're wanting, I noticed at the beginning of this show that Genetic Memory Farms asked, what did Pritzker say? One of the things that I try to do that I feel like other people don't do is showing you exactly what they say. And the only reason I say it like that is because I get frustrated sometimes. I read like an outlet will say, they said, quote, this. And it's like, give me the fucking link so that I can see them saying that. And so I will play the full clip of the statements. I will share the full context of the statements after this interview segment that we're going to have. We're going to sort of set the groundwork, and then we'll bring on a guest from 2 different Illinois hemp associations. So these are, associations that are in the business of selling federally legal cannabis. Here's a question before we move on to that. Genetic Memory Farm says, okay, I'm just finishing the end of the article and I'm curious if the MCA has made a statement about hemp. The only statement I'm aware of them making about hemp, and it actually came from Jim Champion, which is, it's notable. I wanted to mention it. He, I think, has expressed concerns about hemp in the past, and I could be wrong. It'll be on my website. If you guys go back to, I'll have to pull it up. But I believe, if I recall correctly, and you guys should check me on this, I want to reiterate that I believe he was a proponent of the hemp ban that was supported by Pritzker. And so they are pushing. So the question that just came in is, are they pushing to get it under the same framework? They're pushing to push it under, or it seems like in the past, one board member, it's not the whole MCAB, one board member has signed on as a proponent I don't know the board, though, to answer your question, the board has not made a statement on hemp. I just wanted to mention that one board member I know, I believe, has signed as a proponent for the hemp ban and has made some, statements about it in the past, but it's not been a topic of discussion. Again, the Medical Cannabis Advisory Board really focuses on just adding new qualifying conditions. There's some small talk here and there, like we experienced with this meeting that I presented on, where they gave presentations from agencies. But the scope of the Medical Cannabis Advisory Board is only to review petitions for new qualifying conditions. So it's not really been a topic of discussion. I think I'm gonna spark up. I haven't yet. Let's keep the show rolling. So let's talk about federally legal cannabis in Illinois, often called hemp. And if you're watching the video version, we're having a little bit of a technical difficulty. As you can see, I've pre-prepared, or maybe you could hear that. I've pre-prepared this segment, but we're just, fuck it, we'll do it live. We're live right now, so we're having some technical difficulties. Let's see if we can't get this going. Here is Cole's prepared statement. Watch, I'm going to flash. Boom. So let's talk about federally legal cannabis in Illinois, often called hemp. And if you're watching the video version of this podcast, you just saw me do some air quotes. I'm going to do that a few times during this little opening explainer because it's important. In case you didn't know, the terms marijuana, with air quotes, and hemp are arbitrary legal classifications for the cannabis plant that we all know and love. I get frustrated sometimes because the media often frames this debate as cannabis versus hemp. You can watch like cannabis devoted shows and they'll be like, yeah, cannabis versus hemp. That's a poor way to frame this conversation. Many people are under the impression that hemp is a cousin of cannabis, but that's entirely accurate. That's entirely inaccurate, I should say. Let me quickly recap because I know that this can get confusing. It confused me when I was first taught this. So let me just give you a quick recap and share my understanding. So under federal law, we now have two legal definitions for the cannabis plant. Again, all we're talking about is cannabis today. I'm not talking about a different plant here. We're just talking about one plant. There are two definitions now for that one plant, and those two definitions are marijuana and hemp. You might be wondering, what's the difference? Well, there's a dividing line, and it's one single number. If the cannabis plant or cannabis product contains more than 0.3% delta-9 THC by dry weight, it's Schedule 1 marijuana. In other words, it's a controlled substance, right? If it contains 0.3% or less, it's descheduled hemp. That's it. It's not a different species or even a different type of plant. In fact, for most of the cannabis plant's life cycle, it would qualify as hemp. I don't know if you knew this, but it's only in the final weeks that the plant might reach levels that would deem it to become marijuana. And I say to become marijuana because, again, these are arbitrary terms. A cannabis plant through its life cycle can be hemp for the beginning of its life cycle, and then it can magically become a Schedule 1 drug. And that's only a maybe. It's important to clarify that the cannabis plant actually doesn't produce high levels of delta-9 THC. It produces high levels of THCA, which is why when you spark it up and smoke it, or if you have ever made edibles, you have to put your cannabis product in the oven to decarboxylate it. What decarboxylation, aka the application of heat to the cannabis plant, causes THCA to convert to THC, which is, the cannabinoid that we all know and love. So again, the difference between hemp and marijuana is purely legal and not scientific. It's arbitrary, and that's why you might still be feeling confused right now. And I do apologize. It's because of the arbitrary nature of this discussion. It can be a little bit hard to explain this to people, but I would just say take a look at your cannabis products if you ever go to a dispensary. A lot of them you'll find test at, near, or below that 0.3% threshold. In other words, you can go to a dispensary and buy a cannabis product that could legally qualify as hemp. This is something we've talked about on the show in the past. Before diving into the specifics of Illinois, it's worth noting where there's agreement and where there isn't when it comes to cannabis sales to adults. If you watch how this subject is discussed in the news, you might be led to believe that there's a public safety crisis that's being caused by the sale of federally legal cannabis, again, also known as hemp. Most agree. In fact, I think everybody agrees that cannabis products should be age gated, in other words, sold only to adults, and that the cannabis products should be accurately tested and labeled. I'm not aware of anybody in the industry on this earth that opposes sensible regulations that prevent children from purchasing products and allow adults to know what they're consuming. Everybody agrees on the 3-pillar approach. In fact, it's the approach that dispensaries take. You age gate the purchase of the product, you test the product, and you label the product based on those tests. It seems like a tried and true model, and it seems like this is the most sensible solution if you have concerns about the open sale of cannabis. So again, nobody disagrees. I'm not aware of anybody that disagrees that those 3 sensible regulations would satisfy any concerns that you might have. It seems like the real divide is over market structure. Governor Pritzker, dispensary owners, and cultivators who supply those dispensaries mostly support a dispensary-only model for cannabis sales. They mostly seem to favor keeping cannabis sales inside of the limited brick-and-mortar system they've invested in, and oppose allowing cannabis products to be sold direct to consumer or in traditional retail settings like we allow with alcohol, tobacco, and basically any other good that we purchase in our lives. In the past, Governor Pritzker has been a champion of legalization and decriminalization, as from what I understood, he championed these things as a way to move past the war on drugs. That said, the hemp proposal that he has supported in the past would have sharply increased penalties for cannabis-related activities in Illinois. And we've covered this on the show, but in case you didn't know, the Pritzker-backed proposal would have actually made it so that there were $10,000 daily fines on top of the criminal penalties that were established under the Illinois Cannabis Control Act of 1978. Yes, you heard that right. That's our main enforcement mechanism for the cannabis system in the state of Illinois. It's the Illinois Cannabis Control Act of 1978. So the proposal he backed would basically make it so that if you sold cannabis or cultivated cannabis, you could be charged as a criminal in addition to $10,000 daily fines. In effect, it would have empowered state officials and law enforcement to target anyone cultivating, processing, or selling cannabis flower, concentrate, or infused products without a license, like I was just saying. This would expose them to criminal charges, plus that additional $10,000 fine for every day that the activity took place. Notably, the ban would not apply to online sales, so it would leave out-of-state retailers free to continue serving Illinois consumers. As written, the legislation that Pritzker supported would have exclusively targeted local Illinois businesses. Opponents of Pritzker's approach argue that the war on drugs was a failure and that rather than extending its logic through soft bans, Illinois should adopt a more open framework consistent with federal law, which legalized all of these products. Once again, everybody seems to agree that all cannabis products should be age-gated, tested, and accurately labeled. But Opponents will reject the idea that sales must be confined exclusively to dispensaries. That's really where this disagreement comes down to. There are people that have invested in the dispensary model in Illinois, and they believe that is the only place that cannabis should be allowed to be sold. Opponents argue that cannabis is basically generally recognized as safe and should be allowed to be sold basically wherever, in traditional retail formats, at farmers markets. And this is something the cannabis community tends to agree with. In the past, dispensary owners have suggested that it's not that others can't participate in the industry, but that they should find their own lane. For example, they argue that instead of selling cannabis products, these hemp businesses should just focus on supplying packaging or other ancillary goods for the dispensaries. Opponents of this logic counter that this is a flawed approach, and they liken it to being told, hey, you can't open a restaurant, but you're welcome to sell takeout boxes to us, the people who own restaurants. So let's drill down on the latest developments in Illinois. I just want to, like in case you haven't been tracking this subject as closely as I have, I wanted to just remind everybody that the Illinois state legislature hasn't moved forward any hemp related legislation in response to this recent push by the state sanctioned cannabis industry and Governor Pritzker. Like I've mentioned, Governor Pritzker initially threw his support behind that proposal that critics argue would have effectively banned all hemp derived illegal THC products from being sold anywhere but the small and tightly controlled number of dispensaries in Illinois. Political reporters have shared that it's actually rare for the governor to get involved in subjects like these.
He does not often put his thumb on the scale on pending legislation. He often will defer, like, well, that's in the legislature, and we'll consider it when it gets here.
Reports also suggest Governor Pritzker worked to influence lawmakers in several ways by sending in members of his staff to persuade the legislature. Also, it was reported that
he pulled out all the stops. I mean, he called in, legislators to the mansion, tried to kind of wine and dine them.
The Pritzker-backed measure cleared the Senate with only one no vote, but it stalled in the House, where Speaker Chris Welch and others said it lacked the votes to pass. Governor Pritzker had publicly indicated that the bill had the support that it needed to pass the House.
The governor thought he had 60 House Democratic votes for the measure. Welch says that's not true.
It wasn't even close. The governor gave us a roll call. He knew beforehand that we were going to verify that roll call, and that roll call wasn't even close.
The governor told reporters that during a private House Democratic caucus, officials from his administration were verbally abused by lawmakers, and he blames Welch for not intervening.
Why did the governor's members of his team leave out of that meeting in tears?
Well, listen, the governor wasn't present in our caucus meeting, and it got a little emotional. I did talk to those members immediately after caucus, and it's my understanding they reached out to those staffers immediately after I talked to them. Caucus, it gets emotional sometimes.
Brendan Moore, a political reporter from Lee Enterprises, described the outcome as a, quote, big loss for the governor. House Speaker Welch suggested that he understood what this debate was really about. While the governor and others have framed it as a public safety issue, the intensity around the subject largely reflects frustrations with the Illinois cannabis program, which many view as a failure due to its burdensome regulations and tight restrictions.
Welch says tensions ran high due to lingering bad feelings about the lack of minority ownership in the legal cannabis system.
There's a perception that the social equity program was not done correctly in the cannabis space. And here we have an industry where there are a lot of black and brown owners currently in existence. And the legislation that's currently proposed would literally put those people out of business right now. And it would turn it over to the cannabis people.
Most recently, Illinois Governor Pritzker came out and said, Here's some reporting from the Center Square.
Pritzker threatens executive action regulating hemp if the legislature doesn't act, because they've tried to have the debate about this, and the hemp industry has been very adamantly opposed to banning hemp. The industry's got a lot of people that are creating jobs and opportunities and hiring people and paying taxes on this product. So if the federal government's going to allow it, hey, maybe regulate it a little bit in Illinois, but don't ban it.
I wanted to bring on stakeholders in the federally legal cannabis market to get their take on the latest developments in Illinois. And up first, I'm joined by Rachel Berry. Rachel, welcome back to the show.
Good to be here, Cole. Thanks for having me.
Yeah, thanks for coming on, especially on such short notice. Remind our listeners who you are, what you do, and where they can connect with the Illinois Hemp Growers Association online.
Sure. Yeah, I'm Rachel Berry. I'm the founder and CEO of the Illinois Hemp Growers Association. I'm a first-gen farmer. I'm a hemp grower. I've been involved in the hemp space for going on a decade now at the state level and the federal level. And yeah, the Illinois Hemp Growers Association, we're a grassroots membership organization of farmers, business owners, advocates, just like-minded people who want to see, the continuation of a sustainable and equitable hemp industry in Illinois. And you can find us at illinoishga.com or on all the socials, basically under Illinois HGA, and, plug into the community there. We have a Discord. There's a lot of opportunities to stay up to date with what's going on in hemp.
Awesome. And it looks like you guys were founded in 2018. So that's 7 years?
Yeah, I'm glad you asked that, because actually this month is our 7-year anniversary. So we have been out there coalition building, building a community, educating, educating our legislators, our lawmakers, our involved and people who want to get involved in the industry for 7 years now. So quite an accomplishment. We're really proud of the space that we've built and all the momentum that we've built. And really happy to be on the show again. I know I've been coming on the show for a couple of years, and Chris too, and really grateful for this platform, Cole.
Yeah. Well, again, thank you for coming on. And just last week, we saw Governor Pritzker come out and reiterate his position that all cannabinoids, including those derived from hemp, should only be sold in the state's limited number of dispensaries. This week, Governor Pritzker said we're in continuing conversations with the advocates for the hemp industry. I want to ask you about that later on here in this segment. But just really quick, in a report that was released within the last day or so, House Speaker Chris Welch reportedly described this topic as, quote, the single most contentious topic, end quote, that he's faced during his time as Speaker of the House, which I think is notable. According to the report, he also stated that, quote, the issue has been so divisive in our caucus 3 times, but they don't realize how close they are, end quote, to making a deal. So I will just say really quick before we get into my planned questions that in the media, you'll often see this portrayed as a public safety emergency. As you just said, the hemp industry and you guys have existed since 2018. So this is a public health emergency that's been long in the making, I guess. And I say that a bit sarcastically. From your perspective, how are these conversations that you see in the media and between the governor and the speaker, how do you think they're influencing the debate in Springfield? And do you believe that we are actually moving closer to a framework for regulation of hemp?
I think it's disappointing to hear this. Like you said, we've been pushing the issues for many years now, going on, 5 solid years and 7 years of being a part of the rulemaking process and trying to make sure legislators understand, what's happening at the federal level and how that influences at the state level, all that stuff. So to see this come out, I understand, I bet it is contentious because it's been really difficult to actually get the voices of industry stakeholders in the mix. So that's where we keep coming up against these, up and down roller coaster of legislation coming out that we at the IHGA have batted down year after year because it doesn't serve the industry. It doesn't serve business owners of all sizes. It doesn't serve people in the way that it can based on what our federal laws say. So,
So do you think we're getting closer to some actual framework? Like, do you think that what Chris is saying, that we're seeing something, and what do you think we're looking at here?
I think we are getting closer, and I think unfortunately we're moving closer toward what the rhetoric has been, the opposition to what the hemp industry, like I was describing, what we have been trying to say and has fallen on deaf ears. They're moving more in the direction, unfortunately, of that marijuana industry, tobacco, alcohol, kratom industry rhetoric, that hemp is dangerous unless it's being sold through dispensary marijuana industry models and consumed through those avenues too. So,
yeah, that's the sense I've been getting from Governor Pritzker. He'll say, this isn't a ban. We're just trying to regulate hemp. I've seen critics argue, well, okay, let's call it a soft ban then, because basically what you're saying is just that limited number of dispensaries can sell cannabis products, and anybody outside of that would be charged with criminal penalties, in addition to, at least as far as the last proposal read, $10,000 daily fines. So it seems like the big push has been for a dispensary only model. And as a consumer, you didn't say this, but it feels like people are basically saying that cannabis, it's safe enough to be sold in a dispensary, but it's too dangerous to be sold outside of a dispensary. They're not saying that, but that's just what it feels like sometimes as a cannabis consumer. In any case, in your view, what kind of framework do you believe could actually balance consumer safety, industry growth, and the concerns that lawmakers have raised on this subject?
I think some pretty basic, very reasonable safeguards could be put up that will ensure public safety and boost participation in the hemp industry. So we see more money, which everybody's so jumpy about, making money off of this. And, through HB 64 and 1775, we've outlined that. We've given them what they're asking for: 21 up, tighter testing and labeling requirements, bringing the Department of Public Health and IDOA together to come up with reasonable and sensible ways to oversee our program, and to open up the program so that we have more participation. And I think anything more than that is really special interests. It doesn't have anything to do with protecting the public. When you're talking about adding more taxes, especially new licensing schemes, we've already been participating in the market, here in the Illinois and across the United States for 7 years now. And when you look at the actual statistics of public safety and you compare them to other things like literally the marijuana industry or alcohol or even caffeine, you can see that we've had billions of doses safely delivered to consumers over the years. And this isn't they say it's about public safety, but it isn't. This bill would protect public safety. They want more than that. They want tax dollars. They want more money to the state through various different licensing schemes that aren't necessary. When we have the Department of Agriculture and IDOA, who literally it's their job to take on things like this and provide for citizens. So seeing it, keep getting that push into, the special interest rhetoric of this is not safe unless it's coming from a dispensary. This is a federally legal product, which again, I will have to say it again and again and again, marijuana is not. So, we've heard that phrase, just stay in your lane, right? Stay in your lane. Give us what we need to continue to function, to continue to innovate, and to continue to bring sales tax into the state. Just quickly, Whitney Economics, Bo Whitney showed in Texas, 5 million, was it 5 million or 5 billion in sales and $200 million in sales tax. And that's with a kneecap. Like, if you give us the right layout to actually thrive, we will be bringing in so much money just in sales tax. And we don't have to, this is a new industry. This is what we've come up with under the burden of COVID, under the burden of federal versus state legislation and the flip-flop and the threats of bans. being, all these things that have been really weighing down on the industry as farmers and as business owners to participate and grow. Like if we can give us good guidelines, we will be making so much more for that just through sales tax for the state. And I think that should be explored. We shouldn't be putting what's essentially a sin tax until we can prove that there is a detriment to society from these products. We can prove that with tobacco. We can prove that with alcohol. It makes sense to tax those things in that way, because we need the money to accommodate the bad things that happen to people because they are freely available to us. We don't see that with cannabis in any of its forms. So yeah, we just really disagree that we need to tax a newly growing industry, right at the beginning, right when we can finally get some ground under our feet.
Yeah, and setting aside taxes, like you say, it seems like this debate, it really comes down to one thing, and that's market participation. Who and how many people are allowed to participate in this market. I think that that's truly what this debate is about on its face. As I said, it's presented as a public safety crisis, but I'm not aware of anybody that disagrees. Like I would love, I will just keep it at that. I'm not aware of anybody that disagrees that we should age gate, test, and label cannabis products. Even the marijuana industry, they sort of pioneered that model. That is the model that they have in their stores. It seems that the disagreement comes down to who should be allowed to participate and how many people should be allowed to participate. Do you agree with my assessment of that?
Yeah, absolutely. And I would add that, the purpose of the IHGA since its conception, since its birth, is to bolster everybody. Everybody should be allowed to participate in this industry as the federal government has outlined for us. And to see it moving in this direction where, yes, they want to limit who can participate in this industry. And what I'm seeing, the information that I'm seeing both at the state level and the federal level is it's going to be big business. These artisanal market growers, the small shop, the farmers market level grower, we're being regulated out of existence. And that's really disappointing. That's everything that the IHGA stands for, is for this plant to be grown, processed, used in any way that anybody wants to. And yeah, like we were saying, the money, if you follow the money and the lobbyists, you can point to some industries that have the loudest voice in the room and the most money behind the scenes. And if anyone's saying there isn't money moving, especially at the federal level, they just got their fingers in their ears, and their eyes covered, because definitely money is being moved. And it's coming from kratom, alcohol, tobacco, and marijuana. Yeah.
So, yeah, it sounds like you would expect that this federally legal commodity should be treated like any other federally legal commodity, and that everybody has a right to sort of cultivate, possess, sale, or use it. So just shifting gears a little bit here, I wanted to touch on some things that you sort of alluded to. Capital News has reported that much of the talk about hemp regulation has sort of been confined to closed door conversations, or as people in Springfield often say, the smoke-filled rooms. In a quote, they said Representative Sonia Harper, who I believe is actually a sponsor of the legislation you mentioned earlier, a Democrat from Chicago who chairs the House Agriculture Committee, said that the Speaker of the House had not responded to her requests for a public hearing on this subject matter. From your perspective, do you think these discussions have been transparent enough?
No, and there's a reason for that. It's unpopular. What they're trying to do is unpopular. So like you say, keep it to the smoke-filled rooms. That ensures that they have an echo chamber of people who agree with their rhetoric. And they can say that it's like Governor Pritzker said, we're talking with advocates. I think what you mean is you're talking with lobbyists who claim to be speaking with advocates. Let's not, confuse those things. I know the IHGA has been working for years to secure a meeting with the governor.
Yeah, I was going to ask if you had a seat at the table.
No, not once. There have been various opportunities where the IHGA, I feel, is excluded because we are the voice of that small producer who wants that seat at the table and wants to make sure that laws are reflecting our participation in this industry. So that's definitely a detractment. And, to the point of Rep. Harper requesting the public hearing, we've been on that for 2 years. And then this last year, even just getting to the point that that Speaker Welch and Representative Buckner, between them trying to get us this request even heard, that is like, a small mountain that we were able to climb, because it's been hard to even get it to that point after years of just a simple public discourse request. It's been impossible nearly to get that. So yeah, having Speaker Welch deny, not necessarily that he denied it, but we've been brushed off so many times over the years, again and again. We try to catch this before it becomes an issue like this, where it's like, oh my God, everything's on fire and we have to make a decision right now. We have been working to try to secure the proper protocol to getting our voices heard. And it's been an uphill battle since day one. So yeah, thank you to Rep. Harper for sponsoring our bill, and to Senator Preston for seeing that and picking that bill up also. And then thank her also for pushing this as hard as she had to even get the request to be acknowledged. And then this is where we're at. Our top lawmakers are saying, well, we heard from everybody that seems to want to participate, and we have literally been ignored for years. So disheartening.
And I would just say the one hearing that I do recall on the subject related to the Pritzker backed measure, as an advocate, I try to show up for these things, and I'm privileged enough to be able to oftentimes. But because of the way that they announce these things, I think I heard of it the day before. It was, that evening I heard about, it's tomorrow. And it's like, well, I can't just drop everything and go to Springfield. So it's like when they even had a public hearing on the Pritzker back proposal, I don't know. I guess I'm just trying to make the case that even as somebody who's generally able to make it to those things, I wasn't able to make it to those things. I think I recall watching the hearing and they called your name and you weren't there.
I didn't even hear that they were doing it. And this was a gut and replace too. So they completely went around what is in our Illinois Constitution to have the people's voices heard. They literally went around it and then were like, well, where were you? We called your name, you weren't here. How would I possibly have any idea when you have been deliberately, maybe we shouldn't go there, but there's been deliberate measures to avoid public discourse.
Yeah. And, I've got just about two more questions here. First, and this one just sort of came to mind. This most recent statement that Pritzker made, he was asked about a company, Senorita, who was giving out drinks on the beachfront. And I don't know if it was intentional or just how I'm interpreting the newscast, but the way that it was pitched was this almost like a random opportunist is handing out THC on the beachfront. And what the important detail I felt that was mentioned that was not mentioned in the report was that Senorita is a partner of one of the biggest cannabis companies in the state of Illinois and perhaps the country. And so this question is posed to Governor Pritzker as if it's just some random opportunist. And I think even Alderman Hopkins said something to the effect of, these individuals are just skirting on the coattails of the marijuana industry. These individuals are in the marijuana industry. Just a quick, what did you think about that? I'm just curious.
I think it was a bold move. Because I mean, I don't know that much about the situation and what certificates or licenses you need to host events like that. But I mean, it's a federally legal product. But I think, when it comes, it's like such a gray area, if you were selling alcohol or giving away alcohol or giving away cannabis products or something like that, surely you would have to apply for some kind of permit or something to allow that. And it doesn't seem like they did. They set up an event, and then we're like, on the side, we'll be cracking these THC beverages and letting people try them. Like, it's definitely a bold move. But why shouldn't 21 and up adults be able to sample a hemp beverage at an outdoor event like they do alcohol or federally legal product? So
right.
Interesting, though, that, like you're saying, interesting that this is a marijuana partnership,
well, and
very
some of
interesting.
most of the largest companies in the state now are involved in the industry. So it just seems like the goalposts have shifted, and not in the way that people typically mean by that. And what I mean by that is that the reality has just changed. These people are in the hemp industry now. So anyways, I'll move on to my last question. I did want to just quickly acknowledge that the CEO of that company did respond to the post that I made and said, if you need me, I'll be waiting for GODOT, which from what I understand it's almost like I'll be holding my breath. I'll believe it when I see it. I thought that was an interesting response to Pritzker's statement that I posted. So last question, beyond what we've discussed, do you have any concerns about how this debate is moving forward? You've sort of already illustrated it, but I wanted to give you just, sort of the last word. I understand there's been mention of another proposal previously sponsored by Representative Ford. I'm going to break a little bit of news here. I know Representative Ford, it's public knowledge that he's retiring, but I've heard that sort of he's handing off some of this legislation. So setting that aside, unlike the Pritzker-backed plan, I've not seen language on this previously Ford-sponsored proposal. So really my question here is, what concerns do you have about this debate moving forward that maybe you haven't already stated so far?
I think I would just say that we've seen what comes out of Rep. Ford's office and what comes from the folks that he partners with to draft his legislation. And I would assume that we can expect the same thing. We can expect legislation that's a prime example of special interests, creating more bureaucracy for hardworking small businesses, farmers, consumers who love low THC hemp products. I think we can expect that it'll just be another attempt to pull that down and overregulate and do something, that falls short of a ban and falls short of making these things only for sale in a dispensary, but basically set up anyone who wants to sell them exactly like a dispensary, including more license fees and, just ways that very small participants who, again, have every right to participate in this market at the level of their small community or their whatever they want to do. I think we'll see more attempts from anything that Rep. Ford would put forward that would continue those attempts to shut the smallest, most artisanal entrepreneurs out of the industry. And I think we're seeing that at the federal level too, to be honest. Like, it seems like they're moving in the direction of more money to participate, more regulation to participate, and less products that are going to be sold outside of a dispensary. Kind of like we were talking about with the Texas executive order, narrowing the industry down to edibles, CBD smokables perhaps, and drinks.
Gotcha. And I apologize. I said that was the last question, but just zooming out from the state level to the federal level, since you mentioned it, Senator Rand Paul has raised concerns that a federal hemp ban could be on the horizon. He said, like, even within the next few weeks. What are you hearing? What's your take on this?
I'm hearing all kinds of stuff. It's really hard to navigate rumors and conjecture and just all the things. And just having different iterations, and like, there's so much information out there. So what I'm gathering with my experience and goings on in the industry, what I'm seeing is that what I just said, there seems to be a movement toward, no more THCA flower, just to be frank.
Okay.
Low THC beverages and edibles, stricter testing, labeling, requirements all around. And you can read between the lines kind of even what Rand Paul is saying. And I think he's a hemp hero. I think he's been doing everything he can to be, a real ally to the industry and especially the people of Kentucky. But we're up against so much. And listening to him most recently say, what was it like? We're hoping for the best of the bad situations, essentially. So to me, that says, it's going to be really, really difficult, if not impossible, for, even participants like myself. I'm a small farmer. I own land, which is one of the biggest hurdles to even participating in any agriculture, let alone participating in the hemp industry as a grower. And it is still so difficult for someone like me who knows so much about the industry, who's been participating in it, providing public comment, building coalitions, training others and educating others so they can do this work. It is still difficult for somebody like me right now to participate in the industry. And that's why we founded the IHGA and why we've been working for the last 7 years to fulfill what our mission has been this whole time, a more sustainable and equitable hemp industry.
All right, Rachel. Well, thank you. Once again, folks can find the Illinois hemp growers at illinoishga.com. I'll have that link in the description. And Rachel, any last words before we go?
Nope, just thank you, Cole, for the opportunity. And I look forward to staying in touch and maybe doing more talks as the situation unfolds over the next couple weeks, I'm assuming.
Yeah. All I'll say as a cannabis consumer is that I'm just hoping for the best and praying we avoid the worst. Yeah,
we'll be there every step of the way and making sure people know what's going on and how, if there are opportunities for us to, to use our voice and come together and do what we've always done. Rest assured, we'll be there to shine a light.
Great. Sounds good. Thanks, Rachel.
Thank you, Cole.
All right. And continuing, we're going to bring on more stakeholders in the federally legal cannabis market to get their take on these latest developments. Craig, welcome back to the show. Remind my listeners who you are, what you do, and where they can connect with the Illinois Healthy Alternatives Association online.
Well, thanks for having me back again, Cole. Craig Katz. I am the Government Relations and Compliance Director for CBD Kratom, which is a large company vertically operating in this space. We manufacture, distribute, and have brick and mortar stores in 5 states. And as well, I am on the board of the Illinois Healthy Alternatives Association, which is a trade group representing stakeholders in the state of Illinois, farmers, retailers, distributors that sell our products, hemp-derived products. You can see us at ilhaa.com.
.org.
That will take you to our website. Kind of had it up there on your screen there for a minute. Lots of information there in terms of what our policy positions are and who we are and so on and so forth.
Yeah, and I didn't mean to cut you off, but I think it's .org, not .com.
I'm sorry. Did I say .com?
Yeah, you said .com. It's okay though. We'll have it. We'll have the link in the show notes for our listeners
right,
so that they can get over there. Okay, so we were just talking to Rachel from the Illinois Hemp Growers Association about some of these things. We discussed, that Governor Pritzker has sort of come out, reiterated his position that all cannabinoids, including those derived from hemp, should only be sold in the state's limited number of dispensaries. Now, that was last week. This week, Governor Pritzker said, quote, "We are in continuing conversations with the advocates for the hemp industry," end quote. And in a report that was released within the last day or so, House Speaker Chris Welch had reportedly not only described this topic as one of the single most contentious topics he's ever had in his speakership, but he also said that, we're really close to a deal. From your perspective, how are these conversations evolving? And do you believe that we are moving closer to having a framework?
Well, I will say that we have been working with the Speaker's office in terms of trying to find some language that would accomplish the goals of the elected officials in the state, which primarily have to do with child safety and consumer safety. So again, we're looking at 21 plus age gating, appropriate labeling, testing by independent third-party labs, and packaging that is child resistant and also not attractive to children. I think that we're moving in that direction. I think the Speaker would certainly like to get something accomplished in this session. The governor, after not really mentioning it much since last January, has taken up the topic again. I'm not sure what has changed over the last 6 months that it's become more of a priority for him again, other than the fact that maybe since we're getting ready to head into the next session in a few months, it's risen back to the top of his thoughts. I think that the governor needs to really kind of talk to more people in the industry. I think he needs to talk to more stakeholders. I'm afraid that he's still getting a little bit of the sway from the marijuana sector of the industry. And I think that may be coloring his thought process on it. But I also know that the governor is very open to discussion about many things. And I think that under the right set of circumstances, we can make him or help him understand what the priorities are in our industry, which are much the same as his priorities. Not hearing you, Cole.
Thank you. Do you have a sense of what might seem digestible, for lack of better words, to the legislature?
Well, I think that the legislature will agree that the age gating, the labeling, the packaging, the testing are all the things that they really want. I think the temperature there, based on what I've heard over the last several months and going all the way back to the veto session from last year, is that the idea of putting hemp products into the CRTA, the marijuana regulations, is not the most popular idea. The problem with it, from a lot of the legislative perspective, is that it cuts out small businesses. And the small businesses are really the people who are voting for these legislators. The big MSOs, the marijuana companies, while they may be able to donate huge sums of money, don't vote. Most of them are from out of state, and their voting power is limited. Economic power, not so limited. So we need to bring the force of the electorate behind us and let the legislators and the governor know that the people of Illinois, their constituents, want these products to be accessible to them, and they don't want them to be limited to marijuana dispensaries.
Gotcha. And I want to get back to sort of how these conversations are sort of playing out. But I wanted to get your take. This most recent question to the governor, it was posed that there's this company that is handing out THC on the beachfront. And one thing that I thought was notable that was not mentioned in that report, I should say that it was also Alderman Marty Hopkins, or I think I may get the name wrong there.
Ryan Hopkins.
Thank you. Alderman Hopkins said something to the effect of these people are riding the coattails of the marijuana industry. And one thing that wasn't mentioned was that this group that was handing out drinks on the beachfront wasn't just a random opportunist. It was one of the largest participants in the marijuana industry in the state and in the nation. Your take on that?
Well, Alderman Hopkins has been pretty vocal in his opposition to the hemp industry. He has a propensity to support the marijuana industry. I find it somewhat interesting that he blamed that particular incident on someone riding on the coattails of the marijuana industry, because that actually was the marijuana industry that was out there. And I think that was just his not being informed well enough. It was a knee-jerk reaction to something that he saw, and he didn't do his homework on it. On the other hand, I don't think they should have been out there doing what they were doing, because I think that our industry should be regulated. And I think that what they were doing was not what I would do if there was regulation. So I think that that they were taking advantage of an opportunity that they saw, however legitimate it might have been. And I think that, again, something like that actually, puts us in a bad light. And it's not even our industry that's doing it. It's the marijuana guys.
Yeah. Yeah. Like I said, I thought it was interesting. This wasn't just a random hemp company. This was, again, one of the largest participants in the marijuana industry. In fact, this group, Senorita, close ties to GTI, they're often credited as having shaped the regulations in Illinois.
Yeah. The president of the company that sells it, Ben Kovler, is the man behind GTI. And I find it to been very curious that they were out there doing that. But what it does show you is that the marijuana industry recognizes the fact that the hemp industry is competition. And that's why they're trying to get into the business themselves. And that's one of the reasons why they have lobbied so hard against the hemp industry being regulated outside of the marijuana CRTA laws, because they would not like to have that competition.
Yeah. So I want to be very clear. My goal in my next question is not to be divisive at all, but just to really, I see how things play out in Springfield. And Capital News Illinois reported in the past that much of the talk about hemp regulation had been confined. I wanted to pause for a second. Are you guys having the same glitches that I'm having? Again, this segment is pre-recorded and it's almost over. But was it glitching for you there? Can I get anybody in the chat? I don't want to keep going I'll keep going, but if it's not, I'm going to keep playing it, but please drop in the comments if it's glitching into closed door conversations, and that like Representative Harper had submitted requests to have a hearing, but that the speaker hadn't responded to those requests for a public hearing on this subject matter. And like I mentioned, we had Rachel Berry from the Illinois Hemp Growers Association on earlier, and she agreed with the characterization of Capital News Illinois that these have been confined to sort of like the smoke-filled Springfield rooms. Do you think that that's an accurate description of how these conversations have been occurring? And I guess I'm asking, do you think these discussions have been transparent enough?
I'm not sure that they have been transparent enough, to be perfectly honest with you. Certainly not from the marijuana side of the industry, whether it or necessarily from the beverage side of the industry. I know that we weren't involved when Senator Cunningham proposed his bill last session that would call for a carve out for beverages. As much as I respect Rachel Berry and the hemp growers, their proposed legislation would basically open up a free-for-all, because it doesn't call for any licensing fees or taxation. They're categorically opposed to those two tenets, and I think that that's a problem that the legislature will never get past. I don't think that they will ever approve any kind of legislation that does not include taxation or licensing fees. I think they've learned from the marijuana industry that it can be very lucrative to have those two tenets in their process. So I do think that there has been a lack of transparency. I think that public hearings are really called for. I've participated in public hearings in Missouri and Texas, and I think that's the way to go. I think the consumers, the voting public, needs to have the opportunity to hear all aspects of the issues. And I think that by having public hearings, the legislators are put basically on the spot because they can't claim that they didn't know that this was one of the issues, or they don't know that this is a response to some of the things that they've been hearing. So I think that public hearings are the way to go.
Yeah. Yeah. And it just, clarifying with regard, you're right. The taxation is not part of the Illinois Hemp Growers Association. And I believe that Rachel specifically mentioned, like you said, that they're just categorically opposed to it in our segment. I can't recall exactly what she said right now. But your point on licensing, are you trying to say that the licensing fees should be higher than they currently are? Because the little I do understand about that proposal is that it's almost like the licensing fees would just stay the same, and I think it's like a nominal fee of like $150 or something like that.
Well,
maybe I'm wrong on that figure.
Well, so from the growers' perspective,
from the growers, gotcha.
Yeah, they do pay a licensing fee because they're through the Department of Agriculture.
Mhm.
However, retailers, distributors, manufacturers don't pay any kind of fees right now because it's unregulated.
Yeah.
So what I suggest is that there would be licensing fees for those parts of the industry, those different levels, and they don't really take a stand on the licensing fee aspect of it because they feel as though their $100 license fee is appropriate. I don't necessarily agree with that. I think that's a pretty low number. My personal opinion is, and I think that many people in our industry also agree, that if you're in this business and you are operating a company, that you should be able to afford more than $100 for a license fee. If you can't afford $250 or $500 for a license fee, you might not be in the right business.
So really quick, I was just doing somebody just messaging me that processors pay a fee. I'll have to dig into this stuff. I don't know about any of this stuff. I do want to say we're going to continue this segment. It's just about done. ColeMemo.com/live. You don't have to turn on your video. If people would like to call in, open for that. You can just, it's super easy. If you go to ColeMemo.com/live, you'll see a little button that says, call into the show live. And again, you don't have to turn on your video, call in. I'm curious what you all think about what we've covered in the show. I always want to give people the opportunity to speak on this platform. And so we're going to continue with this interview. And then we'll close out the show. I'll be sharing just a few articles that have caught my attention that I think you might find interesting. So, and just quick, and I'll get back. We'll start to wrap up and ask our federal question maybe to close out. Do you foresee it being sort of like an alcohol license? And what I mean by that is, like, there's a laundromat down the road from me, and they got an alcohol license, and you can drink a beer while you do your laundry. And I'm like, America. But like, I guess what I'm asking is, do you see it like that, where like municipalities and localities can sort of, decide whether to issue? Is it at a state level? And I guess really what I'm asking is, will there be limitations on the issuance of the licenses? Because it seems like that's been the real debate. Like, everybody agrees on the 3-pillar approach: the ID, the age gate, the testing mandate.
Yeah.
Or I meant to say the ID, age gate, the testing mandate, and the labeling mandate. But
Right.
It seems like where the disagreement is like how many people can participate in the industry. And I guess that's my question for you. Like, in the proposals that in the language you've seen, is there still that concept that seems really embedded in the marijuana industry of license limits?
I don't think that license limiting is appropriate. I don't think that you can go out and pick winners and losers in this. And that's what you do when you limit the license numbers. I think that it should be an open opportunity for anyone to get a license. And God love them if they can keep a business going. And if they can't, then they're going to be out of business soon enough, and somebody else will move in. But I don't think your liquor licenses aren't limited.
Right.
Your tobacco licenses aren't limited. The only your driver's licenses aren't limited. The only licenses that are limited right now are the licenses for the marijuana industry. And frankly, that's a deal that they cut for themselves. when they got legislation passed to allow them to operate in an illegal industry legally in this state. So I think it's a different conversation as far as the hemp industry is concerned.
Gotcha. And so has language for your proposal, which I think was sponsored by Representative Ford. Is it last we spoke? It wasn't like published yet. Has it been sort of published and available?
So we're refining the language for the new session, trying to answer everybody's questions, and again, trying to meet with people and get their input in terms of what they are advocating for, and hopefully also meeting with the governor's staff and making sure that we are taking into consideration their position to try to get something that everybody can agree on. So our language would not include any limited licenses.
Okay. And I'm guessing though that it may include things like dosage caps or
serving
sizes, purchase limits.
Serving sizes, dosage caps. Yeah.
Would purchase limits be a thing? I like that you can go to the liquor store and just buy as much liquor as you want.
Yeah. So purchase limits is not something that we've ever considered, and it's really not an issue that has been in the forefront of anybody's discussions.
Right. Because it's nothing that we ever talk about with any other product, right? Except for marijuana. But okay. And I guess my last question, Rand Paul has signaled that, we may see action, potentially a ban. He recently went on the Dales report. I don't know if you saw that, and had some strong warnings. I felt like he was really kind of sending up a flare. What do you think? What's your take on the stuff going on at a federal level?
Well, first of all, the first step that we have to do is get through the fall in any continuing resolution or any appropriations bill that might get passed. And there's obviously a big issue with that right now in Congress, as you may have seen that earlier today that the House of Representatives passed a funding bill, and the Senate immediately voted it down when it came across to them. I think it's going to be a very ugly issue in terms of whether or not they can agree on anything. Now, there have been attempts to put hemp ban language in both the House and the Senate. It was removed from the Farm Appropriations Bill, much to the credit of Senator Paul. He's been a very vocal supporter of our products. In fact, he's actually introduced legislation to raise the potency levels that are allowable under the what's currently the 2018 Farm Bill. He's actually done that, I believe, the last 3 years to no avail. I'm not sure that we necessarily particularly support that, but he has been a champion as far as trying to protect our industry. I think that it's, again, going to be a very contentious issue. I can tell you that members of our industry across the country are engaged in lobbying, in letter writing, in petition signing to make representatives and senators aware of what the consequences would be of passing legislation that would ban our products. I know that Congressman Comer from Kentucky is circulating a letter amongst his fellow representatives that supports our industry. He's from Kentucky. He's a very conservative representative, as people may know, and he has actually been cooperating with several Democrats on this issue. As they say, politics makes strange bedfellows. The same thing is happening in the Senate with Senator Paul and Senator Wyden, who is considered to be one of the more liberal senators in the chamber. So I think that we're in a moment right now. It's probably an existential moment for the industry as to whether or not something gets done this fall. I believe if we get through the fall without having any negative legislation passed, that in the next session of Congress, we have a fairly reasonable chance of getting regulations passed, just like we're trying to do in the state, that would regulate the products and not ban them.
Gotcha. Gotcha. Yeah, and I guess with that with that federal action looming, and I've heard like again, Rand was on and he was saying phrases like low dose and stuff. Sounds like if something's going to happen, it sounds like Rand Paul. Well, first of all, he said ideally nothing happens, like you said, we get through the fall. But it sounds like if something's going to happen, it's going to come in the form of maybe like something we saw in Texas, where like drinks and edibles stay legal, but in that limited low dose format. I guess my question is, why in Illinois do anything more than sort of what Texas did, the bare minimum with that age gate?
Well,
With
I've
that
gone
federal
on
action?
record as suggesting that Governor Pritzker, who I'm sure differs ideologically from Governor Abbott in many, many ways, uh, take note of what he did in Texas, which is a very conservative state. And I think Governor Abbott's executive order is pretty much right on point in terms of what it's asking, as far as the age gating, the testing, the labeling, the child resistant packaging, etc. He has responded to the fact that the constituency in his state overwhelmingly sent the message that they did not want to see a ban and they wanted to have access. They had 155,000 petition signatures and 20,000 letters that dropped in his office before he vetoed the original SB3. And I believe that in the second special session, the lieutenant governor realized that he was not going to get his legislation passed under any set of circumstances. The governor was adamantly opposed to it, and so was the state of Texas in terms of the residents. So I think Governor Pritzker could learn from that and take note of it.
Gotcha. Gotcha. And, I know we already sort of discussed this, but just to kind of put it in a bottle, we've got about 3 different proposals. You got the Pritzker back proposal, which I don't know that I've actually seen resurface yet. But, be interesting. I'll keep my eyes peeled. We've got your proposal, which, we've sort of discussed. I've seen language that Ford has published in the past, but I'm guessing it's going to change since you guys are having those discussions. And then you've got the Illinois Hemp Growers Association's proposal. Are you aware of any other proposals in Illinois?
Not at the time being.
Besides that, like drink cutout that you mentioned
Yeah,
earlier.
there has been talk, but I actually haven't seen anything other than what you're already describing. And I think Governor Pritzker's the bill that he supported was Senator Lightford's bill. And it's my understanding that, Senator Lightford is now open to conversation about revisiting the language in her bill. So I think that that's, a significant opportunity for everybody to try to get on the same page.
Gotcha. And would it be accurate of me to sort of put it on a scale of, you got a Pritzker dispensary only model here, and then maybe sort of in the middle, you've got yours, and then far off, sort of towards the more just 3-pillar approach, a farm bill aligned approach, that's the Illinois hemp growers?
It's pretty accurate. And I think when you get into any kind of a negotiation, you have one extreme, you got another extreme, and you try to meet in the middle. And I think that's where we're at. That's where our proposal is going to be at, is in the middle there somewhere. And hopefully that's going to appeal to both sides.
Yeah. I will just say, as a cannabis consumer, and I know I said this to you last time we discussed this, I think that the Illinois hemp growers approach, just that 3-pillar approach, is great. I hear what you're saying, that you think legislators may not be able to sort of accept that loose framework. I hope that there's a future that we can get there, because to me, and I'd like to clarify really quick as we close this interview, we're about 1 minute in there. I said loose framework. It's farm bill aligned framework. So I don't know. I feel like maybe people could look at that as loose, but it's the federal law. And that's what I like about the Illinois hemp growers proposal is that it is aligned with the Farm Bill, and it's simply pushing for that three pillar approach, which I've talked about on the show in the past. I think these high licensing fees, the concerns that I hear about the high licensing fees are that those serve as sort of a gate in and of itself, and it's like, I did get some comments in there. I think that there are more licensing fees with hemp. So it's not just $100 to apply. I got that wrong. And I was trying to find a web page like entry on the Illinois Department of Ag's website so that I could display all the fees, but I haven't found them yet. But I have somebody that I believe they seem knowledgeable of it. They're commenting on our Instagram feed, which unfortunately I can't display those comments on screen. And I've added that to my bumper so that people know that. I feel bad because I see Lord Nero's Empire has commented, a bunch of other people have commented, and I missed your comments, and it looks like you're gone. But we'll talk about those fees in a little bit. I just wanted to say that really quick, and we'll have a few other comments to read that I think will add additional context. And we'll close out this interview. I think it's literally just got a minute left here. So it just seems logical. It seems almost like people get upset with me when I use this analogy, but alcohol and tobacco, like it seems like a closer approach to alcohol and tobacco, or selling cannabis like we do alcohol, tobacco, than we've seen in the current format of marijuana, where it's still treated like a Schedule I substance.
I agree with you. I mean, it's, again, part of that issue is the fact that it is still a Schedule I substance federally, and that does hamstring what can be done as far as the industry is concerned. I mean, there's obviously limitations on what they can do in terms of banking. There's limitations on what they can do in terms of testing. They can't use DEA certified labs to test, which we can, because if they go to a DEA lab, they get turned in, and all of a sudden they're looking at federal criminal charges. That's not certainly not healthy for them.
Yeah. All right, Craig. Well, let's keep in touch on as these things develop. Again, let's hope for the best, and pray that we avoid the worst here. Yep. So, any other thoughts before we go?
Nope. I just want to thank you again for having me on, and wish you a good day.
Yep. Keep in touch.
Thank you.
All right. So I got some good comments in, like I said, that I'd like to read before we close out the show. And then we'll be playing some more those clips that we referenced in full context, the Pritzker clips. But really quick, one of the things that I definitely got wrong, and like I said, I wish I had. I'm scanning through the Illinois State hemp website right now, and I found how to apply, but I can't find the figures for how much everything costs. But I will say USDA has no cost, which I think that's, again, what I was just explaining and in the interview, but also when I paused it there for a second. The thing that I like about the Illinois Hemp Growers Bill is that it's more aligned. It literally just adopts, actually, I believe, the Farm Bill approach. And if Rachel's tuning in, please message me if I'm getting that wrong. But what I mean to say by that is that if the feds change the definition of hemp, like their legislation is agile to that, like it just references the federal legislation, and it just simply codifies like those sensible three-pillar approach regulations. So again, Rachel, if you're watching right now, if not, I'll be sure to send this to you. So processors pay a fee is some commenters that I got, comments that I got. Manufacturers pay a fee. It's $100 to apply, $300 to $1,000 to grow a process. I actually think I did see these numbers online. Now that I think a Google gave me those numbers, but I never trust those AI summaries. But let me put it up on screen right now because this commenter is saying what I saw earlier. Let's check this out. So I Googled Illinois hemp license cost. And the reason I thought this wasn't accurate is because I thought that this, I don't know if it's part of a upcoming proposal or if it was recently addressed or if it can't be addressed yet, but I swear that something with this line that I've got highlighted right here has happened recently. And so I saw that and I thought that was inaccurate, but these figures are aligning with what the person who sent me commented. So they said it's 100 to apply, 300 to 1,000. So I would, I described it as just a fee of $100, but, oh yeah, Rachel's tuned in. She said, yes, you're right, Cole. Thank you. And so, other comments I got is like this, someone said setting higher prices, which is part of this proposal in and of itself is gatekeeping because it's federally legal. And they said something that I mentioned earlier that USDA has no cost. Somebody said, why can't an artisan, is it artisan or artisan? I never know when I see that. I'm so stupid. Why can't a craft grower participate? I think is what they're asking. And then somebody else commenting about what they're doing in Texas. Thank you, Instagram commenters. I'm sorry that I read your comments late and I can't display them on screen like I can with the YouTube and Twitter comments. Looks like we have over 40 people watching on Twitter. How has nobody dropped a comment from Twitter? I think I saw somebody shared it on Twitter. Thank you, Leah. Anyways, yeah, on one hand, I get where they are coming from. When you hear when I say they, I mean Craig and Illinois HAA or whatever the acronym is. I get where they're coming from, where they feel like they need to talk about tax revenue and dose caps and things like that. But I don't understand why we can't look at it differently, especially if we're a state, again, that says we've got we've got legal cannabis. Like, why can't we use this as an opportunity, like as a convenient opportunity, like Minnesota has done, to expand their cannabis market? And maybe commenters, please comment if you disagree with me. I know that the Minnesota marijuana market is controversial, but from what I understand about Minnesota, they codified the Farm Bill, sort of like the Illinois Hemp Growers Association is proposing, except it's got, I think, dosage caps and stuff like that, which personally, I think that dosage caps, I got to remember how I heard this said once, because it was really well put. It was by an attorney. His name's Rod Kite. Dosage caps are the answer to a problem. God damn it, I'm butchering it. But it's the point of what I'm trying to say is that people are saying that cannabis is too high dose, right? The solution is better left to an adult's personal preference is basically the gist of what he said. And I apologize for stumbling through that. It's late in the day. I haven't eaten yet at all. Had a little bit of watermelon, but anyways, been working, preparing for the show all day. Been kind of a little bit of a lightning run of an afternoon. I hope you have enjoyed the show so far. We're about to close out. But I'm curious what you all think. That was sort of our big hemp segment. Oh, snap. No, that's not the end of the hemp segment. We still got just 2 clips to watch. So really quick, if you're wondering, like, where did these comments from Pritzker come from, right? That's kind of how we started this conversation. And like I said earlier, I breezed over it. I like to show people the full like context of comments with full clips and everything else. Someone said, artisans make stuff, artisans are wells. That shows you how stupid I am. Okay, so understand that this happened. So this vape bust happened, and focus on the fact that they talk about how it's focused on, and there's press release after press release on this. The federal government was focused on illegal flavorings in nicotine vapes. Let's watch the report.
A show of force and a major illegal vape bust in the suburbs. Fruity e-cigarette products were the target of the largest ever seizure by the federal government today and was one of their stops, which is at a warehouse near O'Hare. Our Marissa Sulik joins us now with why a Bensenville company was the target of this. Marissa?
Joe, Customs and Border Protection says the 50 truckloads seized today did not have FDA pre-market approval, but the company Midwest Goods Incorporated says they submitted approval 5 years ago. It's still pending with the FDA. And while it goes through that process, Midwest Goods.
And so the point here is
Pina colada, strawberry.
Today, Attorney General Pam Bondi and Secretary
let me
Colada,
damn it.
watermelon ice, pina colada, strawberry.
Today, Attorney General Pam Bondi and Secretary of Health and Human Services Robert F. Kennedy Jr. stood outside this Bensenville warehouse alongside tables of e-cigarette liquid products. These fruity flavors were part of a massive joint operation across the nation today. They say they are seizing $86.5 million worth of products, $14 million from this business, Midwest Goods.
Many of these products were smuggled in from China, circumventing regulations.
The operation aims to end the childhood vaping epidemic by cutting off these flavors geared toward kids.
The retailers all over this country, stop selling this stuff. It's illegal.
The problem that we have had over the last 5 years is that the FDA has not implemented these regulations appropriately.
Tony Abowd with the Vapor Technology Association spoke out after the press conference. He said,
So I'll have the link to this full report in the show notes if you'd like to see it. But, you know, as you can see, this is it literally said it right there. It said focused on nicotine delivery systems, these bottled e-liquids that are manufactured by U.S. companies here in the United States. I don't even know. It's about nicotine is the point that I'm really trying to establish here. And Governor Pritzker was asked about this. And so let's watch that clip. We shared it in the last episode, but we're going to watch it again. Here it is.
Governor Pritzker. Pam Bondi was in Bensenville.
So really quick, Governor Pritzker is asked about this. She says, Governor Pritzker, as you know, Pam Bondi was in Bensenville, for a vape bust. What's your take on it? And I just wanted to say that in case you can't hear it, if you do turn up your volume, you should be able to hear it. I will say that.
Governor Pritzker. Pam Bondi was in Bensenville today announcing this raid on vaping products. Your thoughts on her choice of Illinois to do this? And also, while she was there, took another shot at basically saying that the crime in Chicago is the worst, and the problem is that the government here will not cooperate with President Trump.
Well, I know that President Trump's avid followers, and particularly those who are under his thumb in Washington, are just going to repeat the things that Donald Trump says. So I'm not at all surprised that Pam Bondi has said those things. As to the raid on the vaping manufacturers, I understand. All I can say is that remember what the vaping is about. It's hemp manufacturing and usage. And I'm deeply concerned, I think some of you know, about intoxicating hemp in this state. And we are going to have to do something either legislatively or from the executive branch to stop the sale of intoxicating hemp without any regulation whatsoever in this state. It literally is making our children sick. And it is a shame on legislators and on this state that we are not already doing something about it. We need help from the legislature to make it happen, or if not, we may need to impose executive authority to try to shut those sales of intoxicating hemp down.
Quickly on the Bears, please.
So that was Governor Pritzker's latest statement. I'm curious what you all think about it. If you haven't already, please hit that like button and subscribe. I appreciate everybody that's tuning in on YouTube, Twitter, and Instagram. Someone said, so are flavored vapes federally illegal or not? And why can they add flavors to cannabis vapes? That's a great question. I have no idea. Well, I probably answer the second part of the question, which is that cannabis vapes are by and large federally illegal. So But that first part, I'm not sure on. What I will say about that, thank you for asking that question. I think it's ridiculous that the idea that adding flavoring to something makes it targeted towards children. But, I digress. So this next statement, excuse me, that Governor Pritzker made, we'll have it here, but I wanted to just realize we could probably pull up a little report to watch that gives a little bit of background. We mentioned it in an earlier segment, but we're going to pull this up. So forgive me. Here we go. It's a story by WGN. Let's restart it here.
WGN investigates a lakefront giveaway that may have violated the law. It underscores the confusion around cannabis regulation in Illinois.
Marijuana is sold legally, but only at licensed dispensaries. So you might wonder why other similar products don't face restrictions. Well, investigative reporter Ben Bradley explains.
Chicago's lakefront draws a crowd some companies see as potential customers.
There's so much illegal vending on Park District property, they probably thought, hey, why not? We can get away with it.
In late August, Senorita Margaritas set up shop at several locations, giving away free samples of their THC-infused drinks.
And so one point I want to make here is that this Senorita brand is affiliated with Green Thumb Industries. They are licensed in the Illinois cannabis industry. I would say they're often credited for crafting the regulations in the Illinois cannabis industry, the Illinois marijuana industry, I guess, to use my legal terms. So I posted the video that we're about to watch, which is when Governor Pritzker was asked about that event that we just watched, this event, right? If you scroll down on my Twitter, you'll see that Ben Kovler, the CEO of GTI and now Rhythm, which is their new hemp line, which is funny because that's a brand name from their marijuana product line. If you're familiar with Rhythm Cannabis, not to give them free advertising, but that's a Green Thumb Industries brand. And so anyways, Ben Kovler replied to this video we're about to watch, and he basically said, I'll believe it when I see it. Or for you, I guess, literature nerds, if you need me, I'll be waiting for Godot. I didn't understand the reference at first. I had to look up what the hell he was referencing. So now that we've set the stage, there was this giveaway because Senorita is a federally legal cannabis product. Governor Pritzker was asked about it. This video I made sure to subtitle for you all. I do apologize. The last one wasn't. I'll try to get better about that, but we got this clip. We got one more clip if you're wondering why he hasn't actually done executive order, because he's been hinting at it for quite a while. I found an old clip that I think gives us the answer that if you're wondering that question. But let's watch his latest statement when he was asked about this brand, who, like I said, is operating both in the hemp space and the marijuana space. I should be using my air quotes. They're selling cannabis on both sides of the fence, in other words. This is how Governor Pritzker responded.
And then let me ask you about these THC-infused drinks and Delta 8 and Delta 9. I know you indicated last week some executive action. I wonder what form that could take, and whether or not what you would say to parents about, I'm not just talking about the gummies dressed up as kids. We have video of a THC-infused drink giveaway on the lakefront where they're giving them away. It's Senorita Margarita, is a big company. And Alderman Hopkins would say these companies are getting bolder because they're operating in this legal trade space.
You're right. As you know, I have advocated for new laws in the state of Illinois that would restrict the distribution of hemp-infused and THC-infused from hemp, whether it's drinks or gummies or candies. And what we've got to do is get a handle on this. The legislature was unwilling to do it. And so we're now in continuing conversations with the advocates for the hemp industry But they've got to understand people are getting sick. Children are getting sick. Children are able to get a hold of this in a way that they shouldn't. And we have a regulated environment for cannabis. We should have a regulated environment for hemp. And I am pushing that. If the legislature and if the advocates for the hemp industry are unwilling to do it, then we will take executive action, because this should not be the case. Now, the federal government actually is in a position to do this nationwide and should. Hasn't done it yet. So the question is, are legislators at the national level being bought by people in the hemp industry? Or what's the reason? Why is it okay if children get sick from an unregulated substance that we know we could get a handle on?
So one of the comments that I received that I thought was an interesting point is he's bringing up the federal level. Like, he's almost like, can you please act on this so that I don't have to? Because let's watch this clip. I think that, the thing about an executive order, he's been asked about this many times. He was asked about this last winter when this whole thing sort of blew up, and maybe again in the spring, about what he could do at an executive level. And he wasn't able to give a very clear answer. And this I think pretty well distills it down. This clip is a little bit quiet, so maybe turn up your volume for the next 12 or so seconds. I tried to make it a little loud, but I don't know, just a noise warning here.
So I want to make sure that we're using every possible power that I have in the executive branch to deal with it, but it does take legislation to do some of the things we need done.
So to do some of the things that we need done, which I don't know what that is, it needs the executive branch, or sorry, it needs the legislature. And I think what you've seen in Texas is that you can issue an executive order if you're concerned about age, and you can make that happen. Like, nobody's suing the governor about adding a 21-year age gate for cannabis products in the state of Texas. Some of the things that I should mention about the governor's veto in Texas, the governor's executive order in Texas, is that apparently he's making THCA flower illegal, and vapes are already illegal because of some other legislation that went through. And that apparently there's going to be dosage caps and serving sizes in Texas. So that's unfortunate. But from my perspective, again, I think these problems can be solved by way of an adult's personal preference. You know what I mean? Like, how do we all know not to go? Like, if you want to drink alcohol, how do we all know not to go to the liquor store and grab a handle of Everclear? Like, I don't know. I don't mean to assume anything, but I just inherently have known that. And it's like, I obviously was taught that, but it's like, I don't know. Do you get my point here? Like, I've never drank Everclear, but I have an understanding that I shouldn't drink Everclear. Like, you're taught, like, when you get introduced to alcohol, that Everclear and moonshine are like high proof alcohol. And so, like, unless you're ready for that experience, like, maybe you shouldn't do that. Again, as an adult, I don't personally prefer that type of experience. And so I don't drink moonshine or Everclear. I don't know. Some people don't like when I give alcohol analogies with cannabis, but I'm just trying to use an example of another drug. I do believe cannabis is a drug, and just like coffee, alcohol, or whatever. Hot take sometimes around here, I know. Okay, so trying to think of some other things he said. I thought it was interesting that he said, that we need to work with that they are working with hemp, people in the hemp space. I asked a couple of my guests about that. I don't know. I don't get the sense that, like, he's personally involved, but I don't know. I don't know how all these things work. Well, we've been going for a long time. It's been a long show. I hope you all have found value in this show. I did tell you that I had some stories that we haven't covered today, but you know what I'm going to do is I'm going to save that for another time. I'll paste them in the show notes if you want to check them out. If you're watching live right now and you don't see the show notes, I try to go back and add those after the fact. So if you want to see the clips that we've discussed, some of the articles I've shown, and these articles that I haven't shown that I'll talk about maybe in the future that are relevant to some of the things we discussed today. So if you like these subjects and want to read more, I'll have stuff for you in the show notes to keep you, this is what I always say, appeased. I like when I check the news feed and I'm like, hell yeah, I've got a lot to read through. That appeases me. Anyways, it appeases my ADHD, I think is what it is. Happy Friday, everybody. Someone said hemp is marijuana is cannabis. We make alcohol products that look like candy and have kid appealing flavors, but where's the same concern? Exactly. Yeah, I've seen like Sunny D vodka, like Sour Patch alcohol. And this is a really good point. Alcohol is actually something that'll kill you. Like cannabis doesn't. I'm not saying any kid should get high, especially not accidentally, which I don't think that happens. I think this is a slippery slope scarecrow story. But at least they're not dying. Like if a kid finds Oxycontin or some crazy pharmaceutical or alcohol, like this commenter is saying, like there's actually a chance they'll die. I'm not aware of that possibility with cannabis currently. Not heard of it. If you enjoyed this show, please hit the like button, subscribe to the channel. Somebody said earlier, I have to scroll up. What did they say? If you're tuning in, said something about if you comment within the first something. Oh, here it is. If you post a comment of 8 words or more within the first 15 minutes of the episode ending, it drastically increases the urgency in the algorithm. So folks, if you're still watching and you're a fan and you want to support me, do that. Drop a comment with 8 words and after the show wraps, I guess. And I'd appreciate that. Again, I hope you found value in this episode. Let me know what you think. Stay tuned for future episodes. I know I've kind of slowed down in delivery, but just been a little bit busy with life. Also been sick, if you can't hear that in my voice. But wanted to hop on and share the good word about the good herb. All right, folks. With that, I think we'll wrap it up. Take care, everybody.